Good morning, good afternoon, everyone. My name is Yassine Bhija. I'm actually leading the enterprise solutions business for the healthcare. It is an absolute pleasure. First of all, I'd like to apologize for the delay. I think we had some technical issues, but I think now all is on and the team is fully joining. Good to see you, Dr. Ibtesam.
To see you too. I think my mobile worked, not my laptop.
That's great. I think a lot of us are now, you're joining from your mobile engineer Walid as well. And I think only Dr. Tahir and myself are on laptops. But anyway, so it is an absolute pleasure for me to moderate this session. I think we have really great panelists, and I hope it's definitely worth the wait for the audience. Really true leaders and great leaders in some of the key PPP projects we have in the region. So I'm very excited to have you on. But just to start a little bit, as you know, the role of private sector in healthcare in the provision of publicly funded healthcare services is the subject of many discussions. However, over the last years, we clearly saw that the perspective of public sector leaders for public-private partnerships in the healthcare arena has evolved drastically. And there's a growing awareness of the benefits and the challenges of such initiatives. And we see clear appetite and involvement of and engagement in this journey from the public sector. As a matter of fact, the journey has begun, and we already see the fruits of some of these initiatives and projects. And I'm very happy to have here today with me great leaders who can tell us a little bit about it. So what we're going to be covering with the group here is first discuss the investments and PPP strategy, discuss some of the existing and upcoming projects, go over some of the challenges, and finally have our leaders here share their perspective on expectation of the private sector in healthcare. So without further ado, and me stopping talking, I would like to start with Engineer Walid, and actually maybe the group, if you don't mind, just to present yourself, Engineer Walid. Thank you, Engineer Walid. Dr. Ibtesam, would you mind just presenting yourself, please?
Sure. My name is Dr. Ibtesam Albastaki. I'm basically a UAE national female working in healthcare sector in Dubai. I'm a family physician. From my background, I had 10 years hands-on patient and almost like 11 years experience through various management between the Prime Minister office, private sector, and government sector. So at the current stage, I'm working as a director of investment and PPP, and I've been engaged in various PPP projects from simple PPP operational model till complex, which is the infrastructure public-private partnerships. I'm very glad to be here, and thank you for the invitations, and hope to have a nice and interaction session.
Thank you very much, Dr. Ibtesam. It's a great perspective, and indeed, I think you guys have started already this journey, and advancements have started. Do you mind maybe just sharing with us some of the existing projects that you have, the ones that have already been initiated, and the ones which are basically intended for process, as well as the long-term perspective?
Yes. Basically, at the moment, we worked on a couple of projects. We had projects which were, for instance, around 10 to 20 million US dollar, and we had projects we worked more than 150 million US dollar. So for the smaller projects, it's mainly like an operational management, and these ones we just executed, for instance, like a dialysis center in Emirates of Dubai, with two centers which already been given to the South African group, and we had a very good kind of a win-win situation between the public and the private sector. The other projects we work on real operational management plus some lease component, and this is our rehab facilities, and basically it is at the moment at the contractual stage, and we will finalize it soon within a couple of weeks. And currently we are working on a bigger project, which is the Cardiology Center of Excellence, where a lot of people are basically excited to understand and to know more about it. And this is a model which is where you have design, build, financing, operating. The operation is basically within the government, but we ask, it's a bit kind of a unique model. So we asked the consortium to provide us with a clinical knowledge partner, or you can call it as an affiliation, where it will support our clinicians and to bring the know-how and knowledge transfer as well, where you have a training sessions, even training the residents, and plus and minus from one end to another. It depends on who will be our clinical partners, and as well as transferring the building or the facilities after 25 years from the contract itself. We, at the moment, at the stage of finalizing the RFP, we will require a couple of months to go, and then hopefully by end of the year, we will select the final bidders, and then maybe in early quarter of the next year will be the closure of the financial closure as well. It's a very interesting, it's very unique. You will not find it like in Canada or Australia or any other part of the world. It's made customized for the requirement and demand of the market of Dubai. And of course, there are others, okay, which is in the pipeline. One of them is the long-term care. Maybe I can speak about it a bit later if there is any more question about it. This is something hopefully we're going to release it. We're hoping we will release it somehow by coming couple of days.
I'm pretty sure we're going to have a lot of questions around that, and people would like to know more about it. But before going there, I would just like to ask the same question, maybe to Dr. Engineer Waleed, on basically the existing opportunities. I mean, you've been part of this journey for some time in Saudi. There's a lot happening and ongoing, and the current project. Can you maybe share with us high level those projects?
Yeah, actually, the government approved the 9 initiatives related to the long-term rehab, healthcare, hospitals, and laboratories. So these initiatives have been approved. Most of the projects now in the pipeline, as everybody aware, Al Madina Al Ansar project is now under the RB bidding in the market. Other projects under evaluation. There are multiple projects that need more market soundings, analysis, and information. I believe the coming project will be very attractive for the private, because there are a lot of things being done to enable the private sector with regard to the regulator, the law, the payments mechanism. Everything is now well prepared. So we noticed that some of the projects need more need equipment. We need to do some capacity planning and do strategical approach related to the model of care programs, and to ensure that this will fit the private sector and will help in getting more effectiveness and quality projects related to the patient sector.
Thank you very much, Engineer Waleed. And from a long-term perspective, what are the key projects that you see might come in the future? Before asking the same question to Dr. Ibtesam, what are the key initiatives that you see will come up going forward?
Well, as I mentioned, we are expecting the rehab project coming in the pipeline. It will be very attractive. We believe also the laboratory and radiology will be in the coming project. Today, we are in a very advanced stage. I think the government are very advanced stage with regard to the assessment and the readiness. As I mentioned, the 9 initiatives all are in the process of preparation. We may expect the project coming by these couple of years, coming couple of years.
Can I ask the same question to Dr. Ibtesam?
Well, because I think the GCC or MENA region is going basically for rehab and long term as a priority of the projects at the moment, because there is a gap in the market itself. If you look at our capacity planning, and you will see that there is a demand and there is a gap in this area. So there is a lot of policy guidelines. Really, we need to work on it from the government perspective to reach to a maturity in this area. Meantime, we will prepare the private sector to do the operational part, and we as a government become more like a governance. So therefore, concession model from PPP perspective would be very much in favorable in this area. Of course, there are many other projects. We will look at it from the PPP perspective. For instance, like diagnostic is one of the area we are looking at it as well. Reference lab as well, which is something we are studying it, and it is in our pipeline. Plus, we have one or two couple of infrastructure PPP, which we are just still, I can't basically disclose it at the moment. We are waiting for the higher authority and the government sector to approve it, and based on that, then we can basically announce it to the market. Now, if you look at if you look at the healthcare itself, you can find that there is a lot of areas, and especially post-COVID, that it made or it's actually increasing the mutual collaboration between the public and private sector. And I don't think so the PPP will stop only at infrastructure. We should go even beyond that. For instance, in digital health, for instance, in innovations, for instance, in some consumables and products partnership between the public sector and private sector. I think the lesson that we learned from the COVID itself, it was tremendous, and I think it will do a really good game changers in the future, and it will enhance the relationship between the public and the private sector.
And I'm happy that the team now managed to fix the audio problem. So now I could hear you also very clearly. Thanks, Dr. Ibtesam. And just on that, I mean, you did mention diagnostic, you did mention digital health. How far are these in the making? Are they still at initiation phase or ideation phase, or you basically have relatively clearer plans on that?
Well, we do have a clear plan, because see, if you look at the 50th charter, which was being announced by His Highness Sheikh Mohammed bin Rashid, and he said that in Article 5 that each citizens and residents should have their healthcare services. So that's mean, like, you know, he's trying to emphasize on the role of the technologies. Now, there are many initiatives and programs that we are working on it from the healthcare perspective, and especially the government sector. We do have a programs which is about digital health. We are trying to enhance it and bring those services to the public. The other element that we are working on it, and we have a lot of private sector interaction as well, it's the NABOD projects, which we are trying to integrate the services, or we could say the files between the public and the private hospitals. Now, in Dubai, we almost got ready with 17 or maybe more of those big hospitals. We're working on even the clinics and the polyclinics, because we do have more than 3,000 clinics existing in Dubai. So we need all of them to be in one platform, where then you have one patient file. So I think, see, this is all, we'll try to integrate the service and bring those services to the patient. So patient-centric is very, very important. Whatever projects you're working on it, whether it's from the government perspective or the private perspective, but this is something we really need to focus on it in future. And I think this is where the government is moving towards it.
Thank you very much, Dr. Ibtesam. And actually, to thank a lot of the private sectors present here. We're very happy to know that there is so much more happening, and I think we can participate in the development of Dubai. Engineer Walid, if you can please help. I know that, you know, having been part of the journey of PPPs, and in healthcare and outside of healthcare, you probably have witnessed a lot of the challenges, both from the public side as well as the private side, and you basically have been solving a lot of them along the way. Can you please share with us some of these challenges and how you kind of went about them?
Yeah, basically, as mentioned by Ibtesam, moving from infrastructure PPPs to more related to operational clinical operations is so critical nowadays, and this is a big challenge that to take the risk of the operational part of it, as well as in our GCC countries, the data is not that matured. Again, there is a risk with regard to the demand. I think the big challenge is how to ensure that the information is sufficient for the private sector to participate in these projects in a safe manner. And from the other side, also, the legislations in the GCC under preparation. So it took longer time, like to create the regulator, to differentiate the regulator from the provider, from the payer. Today in Saudi Arabia, we are working in 3 main entities to define the rules of each of the entities, like what is the rules of the regulator, the payer, and the provider. And so critical for the private sector, and it's a big challenge for private to step in without knowing exactly who gonna be the responsible for the regulations and who will be responsible for that. As mentioned, government, Ministry of Health, working hard to enable the private to participate in a very soft manner. Today, the ministry has established well immediate license.
Sorry, allow me, Engineer Walid. I think Dr. Tahir, if you can just mute yourself while not speaking, because otherwise there's a lot of background noise. Thank you. Sorry, Engineer Walid.
So from the regulations point of view, the ministry now enabled the private sector to immediately issue the license for 12 business activities. They reduce the steps from 40 to 7 steps to enable the private to register themselves and to get the license quickly. Almost 8 new business activities being opened, like the urgent care, critical care, the movable clinics, the telemedicine. And you know, today with this pandemics, a lot of things being changed, like the digital health and artificial intelligence, as well the telemedicine become a very critical part, and the health strategies, home care, palliative, all these are now open for the private to participate and to have ability to support the kingdom. Another and more business lines now under preparation in 2021, like sample collections and health educational centers, which can help the citizens getting the right information in the right time. Saying that from the digital health IT platforms, the ministry, with the support of the private, established multiple platforms to support the private and the public getting the right information on the right time for the right patient, such as صحة, وصفتي, تأكد, تطمن, حصن. All these will help the private to collect and to share the right information as quickly and to make the right decision for the patient and for the private investors' decisions. I think after this pandemics, there are many things has to be considered in the BBB, not just pure infrastructure. As everybody aware, the infrastructure and the GCC is in good shape, and we need more things related to the provisions and operations.
Wonderful, Engineer Wade. As we have Dr. Tahir back with us, I'm afraid maybe you could have not heard all the questions we have so far, but one of the things that actually a lot of private players kind of ask themselves is actually how the role between the clusters and the central authorities in Saudi kind of work, and how to basically engage with the PPPs, as well as provide a little bit of clarity around long-term strategy of R1, which is one of the major clusters. But you can cover please those 2 points. Thank you.
Yassine, thank you so much. First of all, please accept my apologies. I was a bit distracted, for another meeting which was going on at the same time. So that's courtesy of being into a virtual meeting. All right. So I'm very glad and I'm very privileged to have Engineer Basudan with us. He's one of the pioneers of the private sector participation program. Actually, I think if I would say that he is one of the engineers who actually built this program right from the scratch, I would not be wrong. I'm also privileged to have Dr. Albastaki now from UAE, since UAE is also pretty active in the PPP space, like Saudi Arabia. I think a bit of it is already explained by Engineer Basudan, but I would just add on what you have asked, Yassine, is that at the end of the day, cluster is the business owner. Any opportunity which is actually identified or which is propagated, it is by the cluster. Because at the end of the day, cluster has its balance sheet, cluster has its financial statement, because the cluster is the spin-off company, which is actually the outcome of the entire transformation program. So at the end of the day, cluster is responsible for delivery of care. Cluster is responsible for maintaining the patient satisfaction. Cluster is also responsible for the quality of care, and cluster is also responsible for the financial activity or the financial accountability of the care delivery. So at the end of the day, there is a care delivered at per SAR basis, per SAR basis, per dollar basis, and cluster is accountable for that. So as said that, I think it is ultimately cluster's responsibility to identify those areas where, based on the directions of the NTP, the National Transformation Program, or NCP, which is the Privatization Commission, and of course other stakeholders, based on their directions, cluster identifies the opportunities to begin with. That's a starting point. So cluster is a starting point, and cluster is a finish point as well, end point as well, because once the cluster identifies the opportunity starts getting mature, and it goes up in the hierarchy into to be run with other stakeholders like the CSC, the Center for Spending Efficiencies. So they thrash the opportunity. They try to make the value for money proposition. They try to understand that it's really going to add the commercial value to the cluster as an organization, or as a commercial and as a semi-commercial entity with the financial responsibilities or the spending responsibility. So once it's done, it goes up based on the scope of the value scope of the project itself. It's less than $500 million or it's more than $500 million. It goes up for approval. So in a nutshell, I think at the end of the day, cluster is the first point of contact for the private sector to begin with. If there are propositions, because cluster has pain points. At the end of the day, cluster has quality pain points. Cluster has patient satisfaction pain points. Cluster has care delivery, seamless care delivery pain points. So if anything which comes up, which is to be considered for the private sector contribution or private sector participation, cluster identifies that, and it could happen between the cluster and between the private sector, that they could engage in a dialogue, and the private sector can propose that they have a solution to certain pain points, as I mentioned earlier. So they can work together to refining a proposition, put it into an opportunity framework, and then send it up for further analysis or further evaluation. So that's the role of a cluster. And at the end of the day, once it is approved from all the stakeholders and it is contracted out. It is contracted to a certain private player after the bidding process. I think at the end of the day, the beneficiary is the cluster. So the private sector, again, the finally qualified party, will come back and work with the cluster to deliver that project or deliver the contract.
Thank you, Dr. Tahir. And on the other part of it, because I think you're one of the first clusters to already have initiated or have a project ongoing, a PPP project ongoing. Can you please tell us a little bit more about the status of that project as well as the future plans that, for instance, R1 might have, if it is clear for you at this stage?
Okay, so Yassine, your question have two components. One is that what we are doing, what is the status of our PSP program, where do we stand, and what are the activities which we are already identified for PSP. I think we are largely aligned with the national priorities, and we are also largely aligned with the priorities what Holdco has already set with in discussion with VRO, because at the end of the day, VRO still has a larger sense of ownership in this program. So currently what we are doing, after being aligned with those national recommendations and national priorities, we have identified more than 13 different project streams, which are candidates for the PSP program. So there are opportunities within the extended care. So we have rehab opportunities. We have primary care, because these are two very high-level strategic areas, primary care as well as the extended care, where we need a lot of private sector support. So we have opportunities already identified in the extended care and in the primary care, both in the clinical services areas and non-clinical services areas as well. And when we say non-clinical services, of course, it is those services which are enabling and support services. So on the other side, we have, as Engineer Basuran was also mentioning, one of the biggest pain points that we have as a healthcare system is the digital health. So we do not have very strong integrated digital health infrastructure. So from a pure infrastructure point of view, there are some projects which are not large PSP scope projects, but they are outsourceable, projects where private sector just come in and do the work very quickly, because PSP project approval process is pretty long, because many stakeholders are involved. Whereas the small contract or small management contract or small outsourcing can be done at a cluster level in discussion with Holdco and in discussion with VRO. So that is in a digital health space. So for example, we do not have a single unified HIS program across the cluster. So 190 facilities, both from the tertiary care to the primary care, they're not fully integrated in terms of the digital health, in terms of the data integration. So we need the support from the private sector, where they can come up with a model, with a framework, which can really put forward a value for money. And one of the areas where we would really like to, that's something I would highlight, is that, Yassine, is that we do not want any PSP program where the private sector does not take the risk and does not share the risk. So whether it's a clinical risk ownership or whether it's a non-clinical financial risk ownership, we want the private sector to really come forward and share the risk with us, just not the financials. So that was an important point which I wanted to highlight, because we are hit by many, or bombarded by many private sector companies which actually share with us their propositions or proposals, but majority of them they do not really capture the real sense of risk sharing. So we want them to come up with a proposal, or come up with a project, or come up with a proposition where there is significant risk sharing between us and them. So the ownership only comes through risk sharing. So within the digital health, there's an infrastructure of unified HIS. Then on top of it, there are so many digital health programs or digital health initiatives which are part of our strategic 5-year strategic plan blueprint that we need support, or anything which, in terms of the digital health solution, which can optimize our work, which can optimize our productivity, which can optimize our performance, and which can optimize our cost in terms of the delivery of that particular care or service. We'll welcome those propositions and those projects. And then we have one of the areas where we are pretty interested is that we have plenty of space in our own catchment area, in our assigned geography. We have plenty of space available, and that is a wide space. So we need private sector to come forward and work with us to build build either housing on that or clinical services on that space. So again, it's a build, operate, transfer model, or a build, lease, operate, transfer model. We can pick and choose model at the end of the day, which makes the sense for value for money. But we have plenty of space available, and also we have clinical space available where we would like the private sector to come forward, say, okay, fine, for your high priority complex clinical services. We're talking about neurology. We're talking about cardiac care. Okay, and we're also talking about trauma. We would like private sector to chip in and utilize that space available with us and work with us to build those or expand those programs which we already have, clinical programs, I mean, which we already have. So that, in a nutshell, one of the projects which I would not leave without mentioning is the long-term care. That's the pain point for and there's a massive shortage of long-term care beds. So we have a dedicated long-term care facility, which is currently now 100 active bed facility. We would like to expand that into a 200 plus beds long-term care facility, because we need more than 200 beds here only in our own assigned area. So that's a nutshell of the projects which we are currently considering for PSP.
Thank you very much, Dr. Tahir, for the very extensive and detailed answer. Very much appreciated. And I think you mentioned the elements of risk and sharing risk. And I know, I don't know if Engineer Walid, you want to touch a little bit on that. From your experience, where did you see the private sector appetite? What kind of risk did you see the appetite for them to take? And what kind of risk you think they should be able, or they should be taking from your perspective?
Well,
yes, for me or for Engineer Basudan?
I'll just start with Engineer Basudan, and then I'll come back to you.
Well, as of today, most investors are focusing on infrastructure PPPs. So to encourage the private to participate on the operational side of it, we believe it's going to be gradual movements, especially with the support services like laboratories, radiologies, which has been now well known in the market, and it's been executed in many other areas. However, for the clinical services, there are some options under evaluations, and hope things will be more clear in the future. For example, is it better to complete outsource it, or just management type of it, or having a real partnership with the private sector and that type of risk? As of today, the model, I believe, need to be really evaluated. And again, the good thing, as it's mentioned also by my colleague Tahir, as the clusters becoming now the provider of integrated, well-coordinated care, funded based on quality and efficiency of outcomes through a single payer regulated by independent regulator. This will make a much clearer position for who's going to take the risk related to that services and how to evaluate and assess the current risk. So from what we have seen in the market, private are ready to take some risk of that type of services. However, to structure it in a good manner and to make the real source of financing applicable for the payer structure and provider structure and funding mechanism, that need private sector engagement along with the public to come up with the best formula. My understanding now, the public sector are sitting with the private sector, trying to define the best model for both of sides, the private sector and public sector, to come up with the best source of financing, best payer structure and provider structure to fund and build the funding mechanism that work for both of them.
Thank you very much, Engineer Walid. Maybe Dr. Tahir, on the same point on risk that you mentioned earlier, what kind of risk would you like to see the private sector taking, and you know, which one you would like to, or which one you see them willing to take?
Right. Yassine, thank you so much. Just to expand what Engineer Baslan just mentioned, I think there are two major risks here. One is the capital risk, another is the clinical risk. Majority of the propositions which we have seen in the past, or they hit us informally, they just take care of the capital risk. They do not consider the clinical risk. You know, at the end of the day, the more important for us is not the capital risk, but it's the clinical risk. You know, if we outsource the service, or we pull in a private sector to come and, let's say, commissioning of the hospitals or operations of the certain service, I think for us, you know, as the owner of the healthcare delivery, or owner of the care for the patients or their safety, for us, clinical risk is more important than the capital risk. You know, at the end of the day, capital risk recovery is much easier than the clinical risk recovery. So a life lost is a life lost, right? So at the end of the day, I think private sector, when they are putting a proposition together, they should consider that they would be partner in the capital risk, or they will also be partner in the clinical risk. So both risk mitigation has to be well taken care of, or very well managed in the final proposition which will be accepted. So that's it. These are the two main streams of risk which we are looking at very closely.
Thank you very much, Dr. Tahir. Dr. Ibtesam, on the risk elements, as well as, you know, on the private sector participation, what would you advise the private sector in their participation in this kind of project, and what would you expect from them, and what advice would you give the private sector to be able to be successful in one of the engagement that you have ongoing and the future ones?
Okay, great. The thing, I'm a clinician at the end of the story, so therefore I'm very much careful about the patient. So always I put the patient as the first, because he has the right, or she has the right, to select and to even to look at the quality of care, the continuity of the care, what standard of care we are actually providing to our patients. So I think it's very important when it comes to the healthcare sector. It's very sensitive, by the way, when you're going between public and the private sector kind of a collaboration, especially at the operational level or at the clinical level. We always, as a clinician, we have a set of KPIs. We really follow that set of KPIs. And these KPIs is very crucial. What we really need to do, I think, in future, and I think it might be sometimes a carrot, it might be sometimes a stick, you know, so you need to balance it. So where basically you're asking the provider to deliver, the private provider to deliver certain services, and you're linking it to your payers, and that's ultimately should be linked to your quality of outcome. So here, basically, you need to really have, from my experience as well, during those small projects where we give the operations to the private sector, always we need to think how we can balance between the patients, payers, and the providers. So the 3 Ps is very important. So what I advise to the private sector, come in and be very transparent. Transparency is very important. Show your KPI and how you manage. And it's very important to have even an experience in the region. So experience is very important. Transparency is very important. The government should even govern that. Set of KPIs should be agreed between the public and the private sector, and these should be linked to the payers, where the outcomes can be measured. For instance, let me give you an example, and maybe if people's or the audience have anything from the clinical backgrounds, if I am doing an hemoglobin A1C test, which is measuring the diabetes level within the 3 months, okay, of a patient. There are providers, they are doing it 10 times per year. It doesn't make any sense. and basically you are trying to damage the whole system and the financials. But if somebody comes, for instance, he is a critical case or high risk, and I do it 4 times in a year, and low risk I do twice in a year, of course I need to incentivize such a private provider, because they are following set of KPI which been agreed between me and the private sector and the payers. So see, this is where it comes the carrot and the stick kind of a formula when we are dealing between the public and the private sector. And I hope I have provide the knowledge to the point. So this is kind of a risk that we always, or this is kind of an advice we always want to give to the private sector. And of course, it's a partnership at the end. So if I don't support the private sector, I mean, they can't support me as well. So it's kind of like an agreement for the sake of the patient.
I really love the word partnership, and for those who know me from the college, it's a word that I believe in a lot, and I think it's really key, because that's actually, it's also how we get the balance to make sure that it's a win-win for everyone. And I think it's a win for the public, private, but most importantly, it has to be a win for the patients at the end of the day. And I think that's what we all work in healthcare for. Maybe a question to you, Engineer Walid, from your perspective and your long experience in PPPs, what advice would you give to the private sector that is willing to engage and trying to basically participate in the privatization of the kingdom?
Well, I think for the last couple of years, the discussion between the private and public, or related to the national side, clinical operational outcomes, clinical outcomes, quality assurance. It is time for private to come with some proposals and workable solutions and take the risk of that. I still remember when I did some projects in water desalinations, the investors themselves take of the outcomes and said, well, we will put all our revenues based on the outcomes. If you are satisfied, then you will pay the money for that services. Here, I believe the private has to step in and take some risk, show the real interest, encourage the public to trust them and to proceed them further. Today, it's very clear that all the GCC countries, maybe the Middle East, trying to attract the private, but there it seems like a border or red lines that private still not yet able to move forward, because banks are giving more restrictions on some conditions, and they have to come up with some proposals, or at least sit at the table and design the structure of the model and the services. They should not keep quiet and wait for the public to come up with the payer structure, provider structure, funding mechanism, source of financing, and they want something in a golden platform. So they have to encourage the public to proceed further.
Thank you very much. And I have actually a question, and it's probably not from the group, but for myself. I've been involved in a lot of these PPP projects myself. There is one question that often comes back, is actually the timing. And sometimes we see that, unfortunately, things take longer. And I see Dr. Ibtesam, so I don't know if I should ask you that question or not, but projects just sometimes take longer. And sometimes we just don't understand why they're taking longer. What is hampering? Can you maybe shed some light into that? Maybe Dr. Ibtesam, as you've been smiling. I'm sorry to throw you.
Well, yes, because it's a culture change, so it's a whole culture change. So bringing the private mindset within the government sector, and especially in healthcare. I mean, it should be fine with the transport, you know, with the road, but when you're dealing with a human being, it's really culture change. I mean, during my experience with the cardiology, it was so, I mean, the way we need to convince our clinicians and how basically they need to cooperate with the private sectors in terms of bringing the right, you know, outcome in place. And it's not easy. We think it's easy to say, easy to write, easy to build up the whole document, but it's very difficult when it comes to the implementation. You really need to have a buy-in from the beginning of the projects to make sure that at the end it should go smoothly with no any turbulence, especially when it comes to the operation. Now, turbulence you might see within the infrastructure, that's normal, which is always you can mitigate it. But however, when it comes to the operations and where it has the clinicians, they come from different schools, different mindset, different backgrounds, so you really need to bring them all. And it's, as I said, it's a culture change.
Okay, thank you, Dr.
May I state here, if you allow me? Okay, I would like to state something with regard our situation in the Kingdom of Saudi Arabia. When we start, especially in the healthcare services, the transformation, we engaged tens of consultants, maybe most of all international best worldwide consultants related to the strategies and design, the models, the legal, the clinical policies, clinical pathways, the financial advisors, as well the technical advisors. We used more than 20 countries as a benchmark. And to be frank with you, moving in the health sector is not something easy. It is complex, and it is really critical because it deals with human. It's not something that you can consider as just straightforward infrastructure project. Saying that, getting the right information from the consultants, we noticed that we need to develop our capacity planning for each clusters. We need to develop our providers, our regulators, our payer clusters now being established, clusters now doing their capacity planning. Again, from the regulatory side, laws being generated, because without law you cannot proceed easily with the private sector. Again, National Center of Privatization. Recently, the government announced the health sector transformation program to unify the system within all the kingdom facilities, which is a major step. So now we do have national health sector transformation programs. From the payer side, the ministry is working hard and the program working hard to come up with the best funding mechanism, ensure that based on the outcomes, value-based. So it's not something easy. We are building a huge platform for private to come with in a very safe manner. During the last couple of years, a lot of work being done to easily encourage and enable private sector to come. That is expected.
Thank you very much, and thank you for the. Do you agree with the same perspective? Do you see the same challenges as raised by Dr. Ibtesam and Engineer Walid?
Yes, Yassine, I think there's no second opinion there, third opinion there. That these are the typical challenges in healthcare sector PPP. First of all, because it is not simple infrastructure PPP, as Engineer Basran mentioned, because there's a huge clinical risk involved in this one. So you need to build the trust. Second is the legacy. So there was a very the health sector has always been very conservative in terms of approaching liberally or flexibly, to adopt PPP practices. So I think there was there was definitely a very strong leadership commitment behind that, but there was definitely a sense of hesitation to go into healthcare sector PPP, like any other infrastructure PPP or any other non-healthcare industry PPP. So there was a clear hesitation, but I must appreciate that there's a traction now. The momentum is picking up now because there's a strong political will behind it. The government they really would like to gear up the support from the private sector for all the reasons mentioned in the past by so many different peers and colleagues. So this momentum is the reason that now we are speaking about the PPP program and PSP program now very actively. Every other day, every 2 weeks or 3 weeks, there's a forum speaking about the PPP in healthcare. There is an institution discussion going on. So I really appreciate the new momentum which is now building up very fast. And I think one of the most complex projects which could never see the daylight was the Ansar Hospital in Saudi Arabia. So it was hanging for the last more than 4 or 5 quarters, but now we have a successful example in front of us that since there was a strong willingness behind it, system was quite flexible now to adopt this PPP proposition in a complex environment. So now Ansar Hospital, I think, is a pathfinder for us. That more complex projects can be pushed in this program and can see the daylight very quickly as compared to the past.
As we say, inshallah. I know I'm way over time, and I know we started late, and I got a note from the organizing team that we have a lot of people still following us, but I'm actually going to be very mindful of your time. If there is any last word you would like to say to the group before we close.
First of all, thank you very much, Yassine, for giving us the chance to explore and to get more knowledge about this. Secondly, I think we believe it is a very promising. The future is very promising because all the things needed as a platform being completed, and better come with something clear rather than to step in a very risky position. I always keep saying that the transformation in health is not something done in very quick. So we might and talk about same topics in the next year, but the things is that private to support and to come with proposals to help public getting more engagement in this business.
Thank you very much, Engineer Walid. I'm not sure if Dr. Ibtesam can hear us because we lost the camera. Any last word you would like to say, Dr. Ibtesam?
Well, yes. The only thing, have some patience. It's the area that it's very much developing in this region, and we are very much towards public-private partnership, whether it's a small projects or large project. But this is actually where we will commit and where the things will go. And things will move forward. I think, and always look at our GRP system and DHA. We are very active. Every on and off, we have something there.
Thank you very much, Dr. Ibtesam. Any last word, Dr. Tahir?
Yes, some of the comments of both my colleagues. But just little on a different angle. I think private sector should not be patient, should not wait for the public sector to come out for a bid. They should come forward. They should add momentum to or traction to the current ongoing PPP initiatives, because this is going to stay there. As Dr. Ibtesam mentioned, now it's the name of the game, right? So PPP has to stay there, PSP has to stay there. So public sector is looking for getting a more support for private sector. So private sector should not wait till the public sector goes out with a contract or a bidding process, right? So they should come up with their own very creative propositions to be considered for a large scope projects and for a small scope projects. So they should not wait. They should come up forward faster than the public sector.
Thank you very much, Dr. Tahir. Thank you very much, Engineer Walid and Dr. Ibtesam. I very much enjoyed the discussion. I think I could go on for another 2 hours on this, but I know that the time has passed by a lot. I very much appreciate your time, your participation, your great insight. I'm pretty sure that the audience has as well. So really appreciate it, and I think at least on behalf of GE Healthcare, I think we're very committed to this. We've been doing a lot in this space, and we'll be looking forward to continue working with you, making sure that this journey is happening, because truly it is a journey. It's a journey that has started, but it will take some time. But we hope to be all with you on this. So thank you very, very much, and wish you a great day, and wish for the rest of the audience a great think tank day going forward. Thank you.
Thank you
so much.
Thank you
everyone.
very much. Thank you. Bye-bye.
Thank you so much. Thank you.
Bye-bye.
Bye-bye.